Penn State graduate students rallying in front of Old Main today, demanding health coverage support from the university.
Recent changes in insurance for graduate students means higher premiums and less coverage, something they say they just cannot afford. Erin Calandra went to that rally, and she's got details in State College tonight. Erin?
Marty, Jen, many of these grad students are already making near the poverty level, and they say if Penn State doesn't step up and help them, some of them may have to apply for government assistance or leave the university altogether.
We are Penn State!
Dozens of graduate students and their families rallying on Old Main to get their voices heard.
We do the teaching, we do the research, we do the grading. You know, we do a lot of work here.
They're upset about proposed insurance changes that would increase their premiums by $1,500 to $3,000 and provide less coverage, something many grad students say they simply can't afford. They say Penn State's only paying them a stipend of about $17,000 a year, and that money goes to rent and living expenses.
If anyone watching this can imagine living in State College for $17,000, you can begin to imagine the fear that we have.
Penn State officials say the changes were made by the healthcare company Aetna and a direct result of the Affordable Care Act. But the university says they're committed to helping by increasing their premium contributions and by giving a 3% increase to the average stipend, which will average out to about $510 taxable dollars a year.
Which mitigates some of the consequence of all this, but it doesn't really solve the problem fully, and we acknowledge that.
But these PhD students say that's not enough. They're asking Penn State to cover the increased premiums altogether.
We see that the university often finds money for other things. Such as, we got the new president, the football coach for State Patty's Day when they closed it down, for the Sandusky scandal. We want them to find money for us. We're just as important as those things.
Now, Penn State officials say these conversations have just begun. They say they're putting together a task force that will be responsible for finding alternatives. If these health care changes do go through, they should start sometime this summer. Live in State College, Erin Calandra, 6 News.